This presentation will consist of a family assessment on the Bankston family. The Bankston family resides in the community of Destrehan, Louisiana, and includes Father Alvis, Mother Melissa, and two daughters, Cameron and Mia. Alvis is the father of the family at 49 years old and is married to Mother Melissa. Alvis graduated high school and completed 3 years of college, although he did not graduate. Alvis works as a deputy for a local but different parish police office in Jefferson Parish. Melissa is the mother of the family at 48 years old and is married to Father Alvis. Melissa graduated high school and completed around 1 to 2 years of college, although she also did not graduate. Melissa works as a manager of appeals and grievances at Ochsner Insurance. Cameron, the oldest child, is one of the two daughters of the family at 20 years old. She is currently single and graduated high school. She is currently in her third year of college with the occupation as a student. Mia is the youngest child of the family at 18 years old and is single. She is currently in her final year of high school and resides in the home with occupation status as a student similar to her sister. Alvis's primary family consists of parents Alvis and Camille, and he is an only child. Alvis's father Alvis passed away in 2020 due to COVID-19 at the age of 69. Prior to passing, Alvis had type 2 diabetes and was diagnosed with kidney cancer in the time frame of 2017 to 2018. Alvis's mother, Camille, is 69 years old, and her medical history includes hyperthyroidism, which resulted in the removal of her thyroid, hypertension, and high cholesterol. Alvis himself is 49 years old and has high cholesterol but is otherwise healthy. Melissa's primary family consists of parents Melvin and Josie Ann and her brothers Anthony and Roy. Melissa's father, Melvin, passed away in 2013 due to congestive heart failure at the age of 69. Melvin was otherwise healthy. Melissa's mother, Josie Ann, is 73 years old, and her medical history includes the diagnosis of Crohn's disease at 19 to 20 years old, hypertension, high cholesterol, anxiety, and depression. Melissa's brother, Anthony, is 56 years old and was born with amblyopia. Her youngest brother, Roy, has PTSD and manic depression, primarily due to the time he served in war. Melissa herself is 48 years old with high cholesterol, anxiety, depression, and in present day is in remission from breast cancer, which she had in 2016. Cameron, the oldest child at 20 years old, has a medical diagnosis of anxiety. Mia, the youngest child at 18 years old, has a medical diagnosis of attention deficit disorder, also known as ADD. With a clinic, urgent care, and primary care physicians located less than 5 minutes away from the Bankston home, the family has a strong relationship with their insurance. The family members visit these locations consistently when ill and in order to maintain good health. The insurance also provides twice yearly cleanings with their dentist. Due to this, the energy direction flow goes both ways between the family and their insurance. Melissa has the strongest relationship with the church within the community. She attends often and is a member of the board for religious retreats. The relationship between Melissa and the church is strong and equally distributed. The other three members of the family have a lesser or weak relationship with the local church community. They attend primarily on holidays, but otherwise not regularly. The relationship throughout the rest of the family and the church is weak, but not necessarily tense. Both Alvis and Melissa's work have equally distributed flows of energies with the individuals. Alvis's father was also involved in the police force, which increases his relationship with his work. Melissa has the opportunity to work from home when desired, which allows her to have more control over the relationship with her work as a positive one. With the rest of the family, it's more identified as Cameron and Mia benefiting from them rather than the occupations benefiting from the children, through things such as income, having their parents home at appropriate times, and experiencing parents having positive relationships with the workforce. Mia has the strongest relationship with the local high school that she attends, as did Cameron in the past where she attended the same school. Due to Mia being heavily involved in the cheerleading program at the high school, the other three family members hold a relationship with the school as well. Mia has a strong and equally directed energy flow with the high school, while the rest of the family members have a more one-sided energy flow as they attend events and provide support to and for Mia, but do not get as much in return from the school. Family time and spending time together is something that the family holds very important to them. They do this on a normal basis and discuss the importance of respecting both themselves and others. The family and family time has a strong and equally beneficial and distributed amongst all four family members. Cameron does live away from home, and this sometimes causes strain between this relationship. although she spends great amounts of time returning home in order to take part in spending family time together, so their relationship has not reached a point of being classified as a tense relationship. Both grandmothers have always had strong and equal involvement in the Bankston family. Following the death of their spouses, relying on the family increased, although only positive relationships and outcomes came from it. Interactions take place with the extended family daily. The relationship throughout the whole family with the extended family is strong and equally distributed. The Bankston family have known their neighbors for years and have always been close, and had a close, friendly, and equally supportive relationships with them. When the family moved to their present neighborhood in February of 2020, neighbors joined in this move in order to stay close to each other and built houses in the same location. The neighbors in the community enjoy weekly dinners together and interact, if not daily, then weekly. The relationship throughout the whole family with the neighbors is strong and equally distributed. Once the Bankston family was assessed, the 5th stage of Duvall's 8-stage family life cycle deemed most fitting to the family's development. Cameron, the oldest child, is 20 years old. And while Cameron has left home, the youngest child, Mia, who is 18, has yet to do so. Therefore, the 6th stage, the launching stage, is not yet applicable for the Bankston family. Alvis is a functional receiver in the family, where he listens, gives feedback, and gives complete attention with conversations, and shows care to when the family members confide in him. Melissa and Cameron are functional senders, in the way that they express emotions clearly, and they are the best communicators in the family. Mia is a dysfunctional sender. Being the teenager that she is, she's a member in the family not as strong in showing her emotions and thoughts, which normally results in the expressions of emotions such as anger in place of communicating how she is feeling and her true thoughts. The power role for Alvis is informational power, with being in the father position and being a main source of advice as well as suggestions in order to better aspects of the family both internally and externally. The power role for Melissa is reverent power, from the way that she does all in her power for her family to be in the best condition, both mentally and physically possible, including putting them before herself, which leaves her being viewed as a very present role model in the family and the type of person her children aim to resemble. With being the oldest child, the power role for Cameron is reverent power, because she has close relationships with her parents as near equals, as well as a role model persona for her younger sister. The power role for Mia is affective power, shown through a habit of negativity in certain situations as a power mechanism and/or attention shifter. This includes withdrawing from family members both emotionally and physically. The overall continuum of the family is that they are a syncretic, egalitarian family. The Bankston family communicates effectively when decisions and power are needed to be discussed. When these conversations take place, each member of the family is included, treated, and respected as an equal and important person in that situation. With role structure, each member of the Bankston family has a formal role and an informal role. Alvis has a formal role of provider, in the nature that he provides majority to all wants and needs of the members of his family. Melissa has a formal role of therapeutic, in nature that when a family member were to ever need any possible type of support, understanding, or comfort, she is able and never hesitant to help. With being close throughout their lives, Cameron and Mia both have the formal roles of kinship, reflecting the maintaining of their relationship with each other as not only sisters, but reliable and trusting friends. This also reflects the way their relationships with their parents and grandparents are important to them. One informal role that could be applied to all family members is encourager. Specific to each family member, however, Alvis has an informal role of harmonizer, as he plays a large part in resolving conflict and disagreements between his family members. Melissa has an informal role of martyr, through the ways that she puts her family first before herself in any time of need or thought. Cameron has an informal role of the family go-between, from the way, like her father, she aids her family members in keeping communication open, as well as having strengths in this skill herself. Mia, being the typical teenager, has an informal role as blocker. She has this role in the ways that she at times expresses negativity to the people surrounding her, also acting on attention where her problems sometimes overshine others. Spending time together, or what members of the family refer to as family time, is very important to the Bankston family because it improves bonding and decreases chances of altering going unnoticed and to keep attentive in each other's lives. An important value taught to Cameron and Mia throughout their lives was the importance of respect. This refers to respect for yourself as well as others. Treating everyone fairly without letting their individual characteristics alter that treatment, such as sex, race, religion, life situation, financial status, or viewpoints on different aspects in life, is another value the family holds with deep importance. Staying aware and active and keeping yourself healthy is an important value in this family. It is important to stay aware of health status, visit local clinics and doctors when both healthy and ill, and also applying the same attentiveness to the people around you, both physically and mentally. Melissa is very involved in the local church community, and she values religion as a strong part in her life. Although no true conflicts have arisen with the differentiation of religious importance between the family members in terms of hostility, it was described as being a possible unspoken conflict in the household. Healthcare is very important to the members of the Bankston family. There is some influence in this with Melissa's working at Ochsner. The family's insurance comes through Melissa's work. Through this insurance, the family is able to keep up with checkups, visit the doctor regularly in order to prevent illness, and visit the doctor when they are feeling ill. In addition to this, the family's insurance provides 2 yearly cleanings at the dentist. All of the family members' primary care physicians are located at the local doctor's office only 5 minutes from the home, which allows easy and fast access. All family members are up to date with all immunizations, including the COVID-19 vaccine. This is heavily influenced due to Albus's father actually passing away from COVID-19. Cameron and Mia both manage their medical diagnoses with medication. The family has had no negative experiences with healthcare, and Melissa is the health leader in the family. As most families do, the Bankston family have stressors they have experienced, as well as coping mechanisms that are put into effect when experiencing stressors. Close to the beginning of the COVID-19 pandemic, Melissa lost her job and went almost 6 months jobless throughout the pandemic. The family also moved from Kenner to Destrehan in February of 2020, and while it was a positive experience and was by choice, it was a stressor for the family in having to adapt to a somewhat new environment. As Mia is 18 years old, she is beginning to transition into adulthood. Being the youngest member of the family, and once she moves out of the home, the family will move into a new developmental stage, and the family home will be an empty nest. As far as transitional stressors, the family experienced 2 losses that greatly affected the family members. 2013 and 2020 were the years these losses took place. From these 2 losses, both Albus and Melissa's mothers became more reliant on the Bankston family. This brought positive outcomes, although it was something the family had to adjust to. With coping, the strengths is that the family has good communication, which has helped them cope with the stressors that they have experienced. The family members are efficient in strategies such as working together to resolve and work through all stressful situations they are placed in. This also includes the internal strategy of normalizing and family group reliance. The coping mechanisms used by the Bankston family are effective. The actual nursing diagnosis for the Bankston family is readiness for enhanced family coping related to verbalization of learning effective coping mechanisms. The goal is that the family will show enhanced family coping within 4 weeks of teaching. This will be shown through determining 1 mechanism per family member to improve coping, differentiating functional and dysfunctional coping habits, and verbalizing 2 stressors that may affect proper coping. Interventions will include educating the family on the benefits of identifying new coping mechanisms and improving coping as a family, educating the family on the differences between functional and dysfunctional coping habits and how to identify them, and educating the family to identify stressors that could still be causing stress on the family without notice. The risk for nursing diagnosis for the Bankston family is risk for impaired child attachment related to partial dysfunctional communication patterns. The goal will be that the family will develop consistent functional communication patterns across all members within 3 weeks of teaching. These interventions include performing open communication across all family members, discussing highs and lows each night at dinner, and writing emotions and thoughts in journals to discuss weekly. Interventions include educating the family on the importance of open communication and improving coping amongst family members, educating the family on the strengths and benefits of discussion and understanding viewpoints of highs and lows in different developmental stages, and assessing journal entries and identifying progression of communicating entry information. The reference slide shows the resources used to guide the family assessment.